Vaccines have provided some hope we will finally be able to get ahead of this pandemic, but the speed of the rollout is no match for the highly transmissible variants now fueling this third wave. A supply ramp-up is expected in the coming weeks, and as Eric Sorensen reports, that could make a big difference in the race between vaccines and variants.
Finally, signs of success in Canada's vaccination program. Close to 3/4 of Canadians over the age of 80 have now received at least one dose, and provinces are now reaching out to younger age groups. It comes after a tense few weeks when vaccine shipments were temporarily cut by Pfizer and Moderna. As recently as this week, Ontario's premier was getting testy with Ottawa.
We still don't have the steady and reliable supply of mass vaccines that we need from the federal government.
It has been a bumpy road for a country suffering COVID fatigue. Several nations, including the UK and the US, manufactured large numbers of doses and got a head start on much of the world. Canada, among many, was desperate to catch up. International vaccine distribution began 3 months ago. At the end of January, Canada was virtually even with comparable countries, having vaccinated around 2% of the population. But after deliveries to Canada were cut, this country fell well behind many others. Deliveries, though, have since picked up. And by the end of March, Canada pulled ahead of France, Italy, and Germany, with over 13% of Canadians having received at least one dose. Indeed, Ottawa now says 9.5 million doses will have been distributed across Canada by this weekend and 40 million by the end of June, meaning provinces will now have to be ready for a surge of vaccines.
We have completed a series of exercises, dry runs and rehearsals with more than 150 stakeholders and federal, provincial and territorial partners from across the country to prepare for an unprecedented distribution of vaccines across the nation.
But another unprecedented surge is also taking place at hospitals like this one. COVID variants are putting more and younger Canadians into ICU beds. Vaccinations will not happen soon enough to fully blunt a third wave of cases, says one ICU doctor.
Young individuals are getting very sick, coming into the hospital, and it's steadily climbing, and that population is not going to get vaccinated in the coming weeks to months. So unless particular populations are targeted to address this, I worry that this is going to continue to rise.
Case numbers will rise, but as vaccines are administered in large numbers, particular populations can be targeted, such as those in congregate settings.
Food processing plants, jails, homeless shelters, and these are the areas I think that are the highest risk. Once we start to vaccinate that sector of the population, you're going to see that the pandemic will really decelerate, especially going into the warmer months.
COVID variants are expected to hold the upper hand for some weeks, but vaccines are coming, and the timetable is moving up for more and more Canadians to get their shots. Eric Sorensen, Global News, Toronto.